everybody. Nice to see a lot of smiling faces in the first couple rows, more than usual, I'm sure. So my name is Christy Gerhardt. I am the new PA Program Director of Marietta's College Physician Assistant Program. It's my honor to welcome all of you, as well as those family, friends, faculty, and staff who have come to support our PA students. In our 20th, that's our 20th Marietta College Physician Assistant Program. I would like to begin by introducing individuals from the college who have come to join us this morning. First, I would like to introduce the president of Marietta College, Dr. William N. Rood, who would like to say a few words. Please join me in giving him a warm welcome to the podium.
Thank you, Christy, and welcome Christy and her husband in the back. Welcome to the Marietta family. The more important thing, unless somebody wants to belong to this bow, I'm going to have to figure out how to put it on my suit. Anybody missing a bow from somebody? If you are, let me know. Welcome. Congratulations. Okay. The easy thing for you guys is to remember. All I got to do is remember 20. Right? So he says, well, what class are you? 20. All right. Then you got to confuse it with 2022, 2023, and it'll work out. But we are so proud of you. We're so proud of your success. We're so proud of your transition. It's kind of a great day at Marietta College. For those of you that have been on campus, what you might have noticed, there's a lot of folks around. We have 100 of our new students at our PIOSOR registration, along with their moms and dads that will be around campus today. We've got 130 honors band and honors choir students from all over the four-state area that are here, hopefully recruiting them to come to Marietta College. And I was telling Janet, I think we have a record turnout in this group. For those of you that aren't looking back, if those of you are down here, look back up, we got the bleachers filled. Okay, so this facility holds about 250 folks. There's about 200 of you down and about another 50 of you upstairs. So on behalf of Marietta College, we're very proud of our PA program. I guess we're now going to have to call it the Physician's Associate Program. You're going to go there, all right. But it's a great program. It's a great place for many of our graduates to continue their education, as well as get exposed to many other graduates from many, many other colleges and universities that come to Marietta College. We are excited about today. We are excited about this day in terms of the transition from the first phase of your career to the new magic phase of your career, where you go out and see, feel, touch, and really get mentorship from a whole bunch of folks that are in the field. As a side note, exciting time to be in the healthcare field. A lot has changed in the last 2 years, and we hope that we have provided you with fantastic experiences, education opportunities, partnerships, friends for life, as you go out in the next phase of your career. So congratulations. Thanks, families, for joining us. And by the way, assume this is your day. We always get confused on commencements and white coat ceremonies and everything. Everybody kind of wants to stand back like they are. This is your day, okay? This is pictures abound. This is embarrass your kids. This is kiss, grandma can kiss you 3 times if she wants to, okay? This is really your day to celebrate a great milestone in your career as a PA student at Marietta College. So congratulations, Christy.
Thank you, President Rood. We also have our provost, Dr. Janet Bland, in attendance as well. I now want to introduce the amazing faculty and staff that are in attendance today. If you could please all come to the stage.
All right.
your name is announced, please step forward to be recognized for all your hard work and dedication to the program and the students. Dr. Steve Howe is our medical director and area physician. Dr. John Russell is a McCoy professor. Dr. Kevin Alton is our academic coordinator. Also an associate professor and area physician. Dr. Stephen Fulton is an adjunct professor and area pharmacist. Dr. David Sams, or Mr. David Sams. He is the assistant professor. He is also and was the interim program director, as well as a physician assistant. Miss Beth Backus, assistant professor and physician assistant. Miss Christina Johnson, assistant professor and physician assistant. Miss Christy Burke. She is our admissions coordinator and the director of education abroad and graduate recruitment. And of course, Miss Donna Venom. She's our administrative coordinator and the glue that holds everything together. Miss Ainsley Wiseman and also Miss Terry Eddy were unable to attend today. Miss Ainsley Wiseman is an associate or assistant professor and also a physician assistant, and Terry Eddy is our clinical coordinator. Thank you all. So this ceremony would not be possible without the tremendous work and sacrifice of Mr. David Sams. He served as the interim program director during your didactic training. So please join me in giving him a warm welcome to the podium.
Okay, good morning, everyone. I'm sorry if I'm a little tired. The cat owners will understand this. Our cats, 4 o'clock this morning, opened up the racetrack in the house. And they started running, and there's no stopping the racetrack when it opens. So, anyhow, thank you for joining us for this wonderful event. I think the last time we gathered was orientation day. It was the very first day that these physician assistant students were starting this program, entering this program. Today is another very special day, and I'm beyond excited to watch them move from their didactic phase to their clinical phase. Getting to clinical year has required lots of studying, late nights, and I'm sure even some tears. Some from you all, and some from us. Given all the hard work, patience, and dedication required to get to this point, I would like to take this opportunity to just briefly thank our staff, faculty, and you all. So I spent the last 10 months as the interim director of the physician assistant program. To say it was a team effort is an understatement. Donna Benham, the glue, was my right hand. And though Miss Eddy is not here, she was my left hand. there was no going forward without them. Thank you two so much, honestly. Without your input and expertise, we would not be here. Thank you so much to Ms. Christy Burke also. So you're doing a great job with the admissions coordination on top of the other roles that you already have at the college. So thank you to the faculty also for being autonomous and independent and keeping the program moving forward. You did not require much of my attention, and I can't emphasize how thankful and grateful I am for that. Thank you to Janet Land and Bill Root also for particularly your help with the community connections we made with 2 local hospitals, amongst many other things over the last 10 months. And Finally, thank you to Miss Christy Gearhart for relieving me of being So, on a serious note though, we're looking forward to your leadership for years to come. So, okay, the fun part. To the class of 2023, I thought it would be fun to give you all some shout outs. This was inspired after I saw my younger cousin make a particularly bold Facebook post recently. Her post said, "Like my post for my true thoughts on you." I couldn't believe it. So now that you're all justifiably terrified, I will ease your fears by saying these shout outs are all Mr. Sam's. My parents are in the crowd, safe. They might not make sense to everyone here. Some of them are funny, some of them are deep, all of them are sincere. So here goes. Steph, Michaela, Bailey, and Hannah, your cast were the first cast I ever signed in my life. For real, that was super cool. So thank you. Sincerely, Dave. Heather and Hannah Lord, believe it or not, I was once a redhead too. Go Team Ginger. I suspect you'll be a couple of the first PAs in the Olympics. Of course, playing spike ball. Carmen, I love your passion. Don't slow down. Keep pushing us all forward. No. Jordan, I cannot imagine you limping around. Not imagine you limping around without a boot on your foot. I'm glad you're better. Kim, I promise I'll never forget to give someone their full 5 minutes for their problem-focused physical exam. Garrett and Justin, if this PA thing doesn't work out, you should look into ping pong. You should sneak your love of ping pong onto your CV somewhere. Well, Brian, your rent's overdue for your room at PA. You're also a killer mountain biker. Brian and I have ridden mountain bikes together. On a serious note, you're owed the program's gratitude also. Thank you. Katie, Danny, Carmen, and Allison. I'm pretty sure you all never stop smiling and laughing. That stuff is contagious, really. Just for everyone who will be in the program, there's going to be a euchre tournament invite coming from one of them at some point. I'm going to make this happen. Spencer, thank you for all of your hard work with NC Pass. Enjoy May 28th. Juju and Dee Dee, you two are going to be famous PAs. Somehow. I don't know how, but you will. Somehow. Maggie, Zahara, Kat, and Bailey, go Bobcats. My alma mater from undergrad and graduate school also. I'll catch your Jackios. All right. Seth, Bree, Kayla, Kat, and Hannah Haynes. This is one of my most cherished shout outs. Goes to these 5. Thank you for participating in research class. Awesome. From one evidence-based medicine lover to another, stay nerdy. Deanne, head up, eyes up, keep rolling with the punches. You are steady as a rock. Lizzie, Lex, and Carly, I think I speak for all of us when I say that your friendship is inspiring. Have fun. And Kinsey, I'd be remiss to not put you in that last group of ladies too, but you get a bit of a special shout out for proving to me that you can do this. Aisha, thank you for letting me know about curry leaves. That was awesome. I love cooking, so. Autumn, you are so quiet and you are yet so sneaky cool. Keep dancing. And apparently we're both coffee lovers. I didn't know this until we had our little powwow with Miss Christy here. So we need to chat more about coffee. So Sheridan and Spencer, thank you for your courage. Lex E. I love your license plate. PA school is definitely number 2. Og dog, right? Og dog. Conrad, you've never met a stranger man. And that will take you far in medicine and life. For real. And Mon, last but not least, you might be as quiet as a mouse, but I know you are and will be as formidable as the mountains of Nepal. Bro, you have a story to write. Go and create it. So thank you all for a wonderful, enlightening year as program director. I look forward to hearing about your adventures during clinical years and throughout the rest of your long and adventurous careers as PA.
It is my pleasure to announce our guest speaker and fellow physician assistant, Lindy Nestor, for the White Coat Address. PA Nestor received her undergraduate degree from Ohio University in Athens, Ohio, and is an alum of the Marietta Physician Assistant Program class of 2009. PA Nestor has a background in internal medicine and neurosurgery and is currently serving as the medical provider program manager in the medical specialist staff office for the Bureau of Medical Services in the United States Department of State in Washington, D.C. Her career has taken her to various geographical locations within the United States, including Great Falls, Virginia, Cleveland Clinic, the main campus, and Washington, D.C. Her overseas tours include the Democratic Republic of the Congo, Israel, and Pakistan. She has been recognized with 2 Superior Honor Awards for assistance and care of patients overseas, including management of the COVID-19 pandemic. PA Nestor was also gifted from the United States Ambassador of Israel the U.S. flag that flew over the U.S. Embassy in Israel in recognition of the care and services provided during her tour. She continues to show her passion and advocacy for the profession as a preceptor to physician assistant students and has talked with programs, schools, and universities throughout the country about the PA profession, as well as global opportunities with the Department of State with a focus to improve diversity amongst medical professions within the department. Lindy and her husband, Jim, reside in Washington, D.C., with their 14-year-old beagle, Lily, whom she has had since PA school. So without further delay, please join me in giving a warm welcome to PA Lindy Nestor.
Thank you so much, Director Gerhardt, for that fantastic introduction. And yes, go Bobcats. I am a Bobcat alumni as well, so happy to join for that Jackie O's brew with fellow Bobcats. And thank you so much for having me today. It really is a pleasure to be here to speak with you about my experiences as a physician assistant since leaving the department over 10 years ago, or this program over 10 years ago. And it's my pleasure to be here amongst students, families, and friends for the White Coat ceremony today. I grew up about 30 miles from here in New Matamoros. It's a one-stoplight town. It's really about as small as it gets. And if I'm being honest, it's not really a stoplight, it's a flashing light. When I was young, we used to ride our bikes up and down the alleys with no hands and sled in cow pastures and get 25-cent baby cones from the local dairy bar. And then I attended New Matamoros Elementary School, which was really the definition of old school. There was no air conditioning, and they used to serve fresh pepperoni rolls, homemade, every Friday at lunch. And then I went to high school at Frontier High School, which is about 30 miles south of here on Route 7 in the heart of Wayne National Forest. And it's right on the Ohio River. And my graduating class had around 90 students, and only a handful of us went on to college. And I never imagined that I would get an education just up the river, and that it would afford me a career and the opportunity to travel the world, but that's exactly what happened. So I'm a physician assistant, a career I chose over a decade ago, and like a lot of you, I chose this profession because it was and still is smart. It wasn't a decade of schooling I couldn't afford. It afforded the option of work-life balance that seemed harder to obtain elsewhere in the healthcare field. And it meant the opportunity of working as part of a healthcare team to take care of patients, all while earning a salary that afforded a comfortable, safe life. And all of this is still true. But while it's what got me to Marietta College, and maybe what got you to Marietta College, it's not what will keep you engaged in a career or help you find meaning in a demanding profession that will often ask a lot of you. What does being a PA mean to me? How is it wrapped up in my identity? How does it contribute to making me who I am? And what could it mean for all of you? That's really what I want to talk to you about today. I remember my time here really fondly. I remember exactly where I sat every day, although that has changed. And I remember exactly where my cubby was. And I remember certain study sessions and exams, and I remember feelings of overwhelm, pride, and of fear. For some reason, I really remember the close of winter semester in between didactic year, or just at the end of didactic year, really feeling relieved of having a break and a few weeks off. I remember Dr. Grossell's lectures fondly and a lot of the conversations with him, and I would not throw away the giant binders that we had for years. They went all the way to the Democratic Republic of Congo with me. More on that later. So when I started clinical rotations, my first clinical rotation was with Dr. Jason Barton in internal medicine, and to this day, he is one of the most important mentors I've had. He was kind, patient, encouraging, funny, and smart. He pushed me to keep learning every day and taught me how to interact with patients. I still remember catching a patient in atrial fibrillation, discussing appropriate workup and management, and how proud he was of me and me of myself. I also loved Dr. Stanley and my OBGYN rotation. He gave me cases and coursework to study every week, and he quizzed me on them. I still remember him calling me in the middle of the night to tell me that I needed to meet him at the hospital for a delivery, and praising me for my communication skills when I had to tell a patient that she needed an urgent C-section. And a stroke of amazing luck and timing, he also happened to be managing my sister's care during my rotation, and I was able to deliver my niece Evie, who's now 13 years old. Not all of my clinical rotations were as rewarding. There were ones that were really rough, and to this day I can still remember struggling through them. But they all taught me something, even if it was that specialty was not for me. Looking back now, I really wish that I had been more patient with myself and more patient with my preceptors, and more earnest in soaking up every opportunity to learn. Before you know it, you'll be done with your clinical rotations, you'll pass your certification exam, and you'll finally read a book for leisure, and you'll be off to find your first job. It's overwhelming and it's scary. You've just spent a lot of money on an education, and you're ready to start making money and have a life. I would encourage all of you during that time to reach out to PA colleagues that have started employment in the last 3 to 5 years and talk to them about the hiring process, things like negotiating your first salary. Know that besides your clinical skills, there are a lot of important attributes that will be key in being good at your job. Are you good at communicating? How are you at giving or taking feedback? Once you're out, consider reading books or talking to friends or colleagues about honing these skills. And read Crucial Conversations. It will help you communicate more effectively with your patients and with your colleagues. I think it's also very important at the start of your career to figure out what motivates you. Let me tell you a little story. When I was trying to get my current job, I needed more pediatric experience. So I started working part-time in an urgent care, in addition to my full-time job. And let me tell you guys, picking up a 12-hour shift on Saturdays after working a full work week, I was the grumpiest, grouchiest, most miserable human ever. But I learned a few really important takeaways. Number one, I'm not all that motivated by money. This was really crucial for me. If I chose at that point in my career to follow the money, I would really be a very unhappy person right now. So do something you love, and the money will follow, I promise. Number two, sometimes sacrifices are necessary to get what you want or need out of life, but you have to make these sacrifices strategically to preserve yourself and protect yourself from burnout. And number three, we are never done learning. If you start to get bored, anxious, or withdrawn from work, consider a new clinical path. It's one of the beauties of our profession that I don't think we take advantage of enough. For me, almost from the start of my clinical rotations, I knew I was destined to primary care. This is the point in the speech where I'm genuinely a little concerned about losing some of you. Hear me out. It's a really cool job. Every day is something different. There's a joke in primary care that you know a little about a lot, but the truth is, you know a lot about a lot. Some of the smartest, most talented PAs, MPs, and physicians that I've had the pleasure of working with are internists or primary care providers. You'll be the main touch point for your patients through some of the most important moments of their life, such as a new medical diagnosis, like diabetes, that finally pushes them to lose the weight and change their diet. Your face will light up with theirs when they lose the weight and finally keep it off. A difficult divorce, supporting them through counseling, medications, and most importantly, by listening. Convincing a high-risk patient to take PrEP, potentially saving them from a life-altering diagnosis. A young, healthy female with a new breast lump, from, we'll get some imaging just to be on the safe side, to, I'm sorry to tell you, you have an aggressive form of breast cancer. Talking to a teen about sexuality and gender identity before they're ready to discuss it with their parents. Managing the grief of a miscarriage and then the struggle of a newborn. A new mom admitting she doesn't always love being a new mom, and the clear relief on her face to safely say it out loud in your office without fear of judgment. A Marine with malaria, now this one is obviously from overseas, watching all of the telltale signs show up on his lap and not wanting to leave his bedside for fear that as soon as you do, everything will go wrong. You'll still get the opportunity to act as a first responder outside of the office, dealing with your first code, say on an airplane, talking with the family, being present, kind, and patient, as well as heartbroken right along with them. Convincing that 65-year-old male who swore he'd never get a colonoscopy, ever, no matter what you say, ever, to getting one that finds a polyp that would have been cancer in a few years. Reducing your first nursemaid's elbow. It is so rewarding. The parents look at you like you're a miracle worker. And there's levity too. A patient coming to you for an urgent same-day appointment. She frantically shows you her hands, which are blue. You look at them a moment and then grab an alcohol swab. It was dye from a new pair of denim blue jeans. So I have spent a majority of my career in primary care, and I really enjoy it. It's been professionally stimulating and rewarding, and I feel I've made a huge difference in every place I've worked. I urge you to consider it for your chosen career path. So you heard in my bio that I've been all over the world, and now we're to that part of the story. Because my husband works for the Department of State, I learned that they hire physician assistants and nurse practitioners to work in embassies and consulates all over the world to care for American diplomats and their families. I remember the exact conversation we had when we learned I could join alongside him. Why not? Even if we end up in the middle of Africa, what an amazing adventure. And then before I knew it, the two of us, along with all of our belongings and our beloved beagle Lily, were on a plane to Kinshasa, the Democratic Republic of Congo. I worked alongside locally employed nursing staff to care for approximately 200 Americans and their family members. I had 3 surgical emergencies in my first 3 months. And I remember thinking, how many right lower quadrant pains did I send to the emergency room that never ended up being an appy? And I've never seen a choledocholithiasis in a patient of mine, let alone a patient of someone else's. How is it possible this could be happening in a patient population this small? And then another instance where I said to myself, it should never be this hard simply getting care for patients, because I had to convince the attending at the local hospital to admit my 28-week pregnant patient with severe headache, neck stiffness, and light sensitivity for meningitis workup. Luckily, that was viral. All of these moments felt scary at times, and of course overwhelming. But I always did 2 things. Trusted my clinical instincts and training, and communicated clearly, directly, and compassionately with my patients. These moments in medicine, especially in medically austere locations, are humbling. They remind all of us that life and health is fragile, and we're often not thinking of that until its security is in question. After 2 to 3 Ebola outbreaks and a few more medical emergencies, it was time for my next tour in Tel Aviv, Israel. My patient population increased pretty dramatically in size to around 900 diplomats and their family members, but luckily for me, the medical austerity went down considerably because Israel has Western equivalent medical care. I remember my first urgent medical case there when a mom called me in the middle of the night saying her 4-year-old was being kept awake by testicular pain and he wouldn't let her look at it. I talked with her and explained my concerns and said tentatively, so I think you need to take him to the emergency room? Not sure if she'd be too anxious to go alone or balk at the idea of not being evaluated first in the health unit. Rather, she responded, okay, no problem, we've been there before. And I was shocked at the difference in the two experiences. Israel was a wonderful opportunity to work amongst a group of peers and colleagues who were subject matter experts in emergency preparedness and working together for the greater good. They are incredibly direct and unforgiving when it comes to communicating with patients. You're fat, you should lose some weight, is a completely appropriate comment to say there. That was sometimes a real struggle for my American diplomats, but occasionally refreshing for me. I visited garages that had O2 hookups and suctions in every parking space so that they could quickly move patients underground in case of bombings or attack. I observed weapons of mass destruction drills where they brought in contaminated patients that had to be decontaminated safely to protect hospital staff. I really learned about the resilience, hard work, and importance of community when caring for patients during my time there. My third overseas tour was in Peshawar, Pakistan. There is no additional medical support staff there. So I spent a lot of time learning and practicing what all of our ancillary support staff does to make sure that we have time and energy to take care of patients. I really encourage you, from maintaining lab equipment, to drawing blood, to working an IV pump, to moving and transporting patients. There's so many aspects of patient care that ensure that we can have the time and energy to focus on our patients. During your rotations, ask these questions. Talk to the nursing staff and learn from them. Talk with pre-hospital providers and have them teach you their techniques. Now is the year where it's appropriate to do that, and you might not ever get the opportunity to do it again. I would be remiss in discussing all of these experiences if I didn't mention the virulent elephant in the room, COVID. The pandemic started my last 6 months in Tel Aviv, and as I don't need to tell you, it changed everything for everyone. I can't imagine what it has been like for all of you as you work to navigate this new healthcare world. I'm sure at times it has felt unfair that this is happening at the very moment where you chose to practice medicine. And at times it's made a very difficult profession feel impossible. For sure, you are going to experience overwork, low resilience, challenging patients, and exhausted support staff. I challenge all of you now to consider what you will do to take care of yourselves so that you can take care of patients. And with that backdrop, it's time to offer some unsolicited advice. Number one, set good boundaries, both with work and with your patients. Number two, be kind, not just to your patients and the people you work with, but to everyone you come across. In a lot of ways, the exhaustion, anxiety, and fear that has accompanied the pandemic has tended to make everyone the worst version of themselves at times. Just don't forget you don't know the full story. Be kind and give grace. Take care of yourself. Sleep, exercise, eat well. You're 100% thinking, duh lady, this is not revolutionary advice. But think about it. When stuff is really going down, like the first healthcare workers managing COVID patients, the hospital workers caring for dozens of patients after the Boston Marathon bombing, Katrina, the list goes on and on. When the going gets really tough, what's the first thing everyone stops doing? Sleeping, eating well, and exercising. So really continue to do those simple things when the going's getting really tough so that you can continue to take care of your patients. Practice gratitude. I can't say this enough, and there's a lot of research backing it. People who practice gratitude are happier humans. When I couldn't sleep at night in Peshawar, I would lay in bed and list all the things that I have to be thankful for. My husband, my beagle, my health, my family, my country, and I would fall asleep. Having lived many years overseas, trust me, we all have a lot to be grateful for. Keeping a journal, set a reminder on your phone, do a Peloton gratitude meditation, whatever it takes, just practice gratitude every day. You will hear this so much. This is advice from Dr. Gersel back in the day, and I'm sorry, I'm sure it's annoying, but I'm going to say it again. Listen to your patients. Not only will they tell you what they need, but it's the most important part of taking care of them, and it's what makes PAs good at what we do. No matter how busy your day is, no matter how impossible they're being, slow down, stay calm, and listen to your patients. Lastly, find meaning in your work. Obviously, we have all chosen an altruistic profession, and helping people matters and makes a huge difference in their lives of all the people that we touch. But if you don't find it meaningful, it won't be fulfilling, and it will feel every day like really hard work. So during your clinical rotations, spend some time thinking about what's bringing you joy and why. I have to say that writing and sharing this really helped to remind me what an awesome profession we have all chosen. What does being a physician assistant mean to me? It means I pride myself on working well with others and love being part of a team. It means I'm a lifelong learner, and I never hesitate to say, you know what, I'm not sure. I'm going to look that up and get back to you. It means I take pride in being an excellent communicator and connecting with people. I'm part of the solution, I improve access, and I improve patient outcomes. And it means I love my job and my profession. So congratulations to all of you. Your hard work, not just in your first year of PA school, but in the countless hours of school that led you here, will afford you the opportunity, any opportunity you can set your sights on imagining. You have already done something impressive. You've chosen an inspiring and rewarding career. I wish you the very best of luck in starting your journeys as clinicians, and look forward to hearing about all of the amazing things that you'll accomplish.
Thank you, Lindy. In 2018, the first Dr. Gloria M. Stewart Scholarship was awarded in recognition of our founding program director's illustrious career and zealous dedication to the PA profession. The criteria for the scholarship were established with the knowledge of Dr. Stewart's values. The criteria included preference for students that are non-traditional, first-generation college, first-generation healthcare providers, responsible for dependents, and/or are from economically disadvantaged backgrounds and/or communities. In addition to the criteria, the scholarship committee decided to award the annual scholarship to a second-year student who, during their didactic phase, displayed a professional demeanor with an outgoing and positive attitude, professional interactions with faculty, staff, and other students, and a team-based mindset by their willingness to help others and participate in the Marietta College Physician Assistant Student Society, program events, and local community. It is my pleasure to announce this year's Dr. Gloria M. Stewart Scholarship to Miss Abby Ashball in the class of 2022. Unfortunately, Abby had a prior commitment and was unable to attend today's ceremony, but please still join me in a round of applause for her. Are we ready for some white coats? So today is a very special day. It marks a day of transition. The transition from being a student to a professional. Receiving your white coat is an important step on your journey to becoming a certified physician assistant. Now, I would like to provide a little history about the white coat. Originally, lab coats were beige in color. That changed when hospitals adopted the color of white as a symbol of healing, cleanliness, and hope. Physicians began wearing white coats around the 20th century. For them, the white color symbolized professionalism, purity of intent, and seriousness of purpose. Although white coats have been around for more than 100 years, the white coat ceremony is quite young, originating in the early 1990s at Columbia University's College of Physicians and Surgeons in New York. Since that time, numerous healthcare schools have adopted this special tradition, including Marietta College. At this time, I invite the faculty and staff to the stage for the awarding of the white coats. students. As I read your name, please come forward to receive your oaths and the Marietta College Physician Assistant Program pin. Kayla Vinegar. Lexi Babenchik. Zahara Campbell. Deanna Dakdu. Conrad Daniel. Michaela Duramo. Carmen Gwen Carly Hensley. Maggie Hirschfeld. Stephanie Hoffman. Caitlin Joyce. Garrett Kellogg. Justin Kennedy. Autumn Kickbush. Julianne Lebo. Bailey Lewis. Kimberly Lipscomb. Brian McAllen. Allison McSherry. Katarina Makarova. Sheridan Oliver. Aisha Rafa. Elizabeth Thomashin. Seth Taylor. Anna Ward. Brianna Ward. Jordan Young. Students, please stand and face the center of the room as you join me in reciting the PA oath that can be found on the back of your programs. I pledge to perform the following duties with honesty and dedication. I will hold as my primary responsibility the health, safety, welfare, and dignity of all human beings. I will uphold the tenets of patient autonomy, beneficence, non-maleficence, and justice. I will recognize and promote the value of diversity. I will treat equally all persons who seek my care. I will hold in confidence the information shared in the course of practicing medicine. I will assess my personal capabilities and limitations, striving always to improve my medical practice. I will actively seek to expand my knowledge and skills, keeping abreast of advances in medicine. I will work with other members of the healthcare team to provide compassionate and effective care of patients. I will use my knowledge and experience to contribute to an improved community. I will respect my professional relationship with the physician. I will share and expand knowledge within the profession. These duties are pledged with sincerity and upon my honor. At this time, I would like to invite Dr. Kevin Olton to the podium for Hal's helpful and hilarious pearls.
Okay, well, great, thank you. Honored to be chosen to give this speech. As some of you may know, that have been here a long time, Dr. Purcell, and maybe that's it. This is not my first white coat speech. Several years ago, the person that was supposed to come give the talk that was so eloquently delivered by our PA alumnus today did not show up, and Mrs. Collins was basically about 1 minute till 10, kind of just freaking out, right? It's like, oh my God, what are we going to do with that? It's like, myself and Mr. Pierce at that time, who is no longer with us. He's still alive. We said, we'll just do it. We'll just get up and wing it and all that. So it was fine. I said, I'll go up and tough. So I went up and winged it for about 5 minutes. Luckily, there was someone in the class that that our family was friends with. Someone that was a very good friend of my brother-in-law that went to high school together in Cambridge, and we knew them when we moved to Columbus, blah, blah, blah. So I was able to, pick them out, make fun of them during my 5 minutes or so. And I said, okay, I'm gonna let Mr. Pierce talk. So in those 5 minutes where I basically up here and just winged it, he was busily writing out basically a speech. And he basically got up here for 15 minutes and talked like he had been preparing for hours. And he basically threw me under the bus. I have prepared more for today. I'm not sure it's going to be any better, but I have prepared more than I did then. Okay. So this is the Pearls and funny comment lecture. Dr. Howe, who's been the medical director since the beginning, started this. And we call it the golf ball lecture, right? Because he started by giving us a golf ball, right? And then he went on and talked about many things and all that. I like to point out my ties to many classes. I've been associated with the program since the beginning. I was a preceptor for a very, very long time, and then joined the faculty as a full-time faculty member in 2014. So before that, I was with the program for a long time. Mr. Sams was one of my students. I precepted him when I was still doing full-time OB/GYN in Cambridge. So I've had a lot of students come through. Sarah Sapp did casting the other day. She was one of our students at precepted too, and all that. So it's interesting that golf ball is the lecture today because I have ties to every class like that. Okay, this is a golf class, right? There's several people in the audience that I play golf with. Lexi, plays golf, right? And I've actually known her father longer than she has because we met in Columbus and we play golf clubs, blah, 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 all that, We've had several people in classes from Cambridge, friends of ours, very close friends. I was honored to have my daughter in class several years ago. My daughter's best friend, who's our neighbor, is one of the second-year students. So it's interesting that I was chosen to do the golf ball lecture because my tie to your class is golf. So I'm going to just run through a little bit what we've done so far this year, right? We talked about orientation and we talked about the culture for Marietta College. Okay? I put my glasses on, but I printed this in big enough font that I don't need it, so that's good. We talked in orientation about culture, right? We mentioned that first day that we never promised you that it was going to be easy, but we did promise you that it was going to be worth it. And look back from that very first day when you were in orientation to where you are now. Hopefully the journey has been worth it. We're going to talk about that. Our purpose as your faculty, as your educators, is to make you do what you think you can't do. When you get to the point to where you think you can't do it anymore, our job is to convince you, poke, prod, whatever we need to do to convince you to do it. We've all done this long enough. The program's been successful enough that the path works. Okay? Keep the program, and when you don't think you can do it, our job is to make sure and remind you that yes, you can, because many, many in front of you have done it. And you're not alone, and everybody can do it. So that's what part of our culture is, The graduates come back. The graduates come back and teach you. The graduates come back and join the faculty, This program is built on the culture we're trying to strive, and that's what we go for. Okay? It's a hard problem, right? In lecture, I do quotes, funny things, and all that, so we weren't going to get away without quotes, right? So our first quote we're going to go with is Drew Brees, right? How do you get through a program like this, okay? His quote is, if you're worried about the mountain in front of you, you're going to trip on the molehill right in front of you, okay? You have to take it day by day, right? You do not eat an elephant one bite at a time. You eat an elephant one bite at a time. Okay? That's how you do it, day by day. step by step. All we're asking you is to win today, all right? Win the day, all right? That's all your responsibility is. We ask of you as a faculty to come every day. Win today, okay? Moment by moment, piece by piece, day by day is how you get through medical training. It's how you basically get through life, right? And carrying weight, worrying about rotations, worrying about what's going to happen later on is just added weight that you don't need. You get through this program, you get through medical training day by day. There'll be plenty of time for worry and things like that. But all we ask of you is to be great today, okay? Don't worry about tomorrow. When you come into that classroom that you live in for that last 10 months, right? Be great today. And it goes along with being your best today. It doesn't mean that we demand your best that you have every day. But we do demand that you give it everything you have that day. You are not going to be your best every day. There's going to be days where you do not want to go to the office. There's going to be days where you have to do things that you don't want to do. There's going to be days where you don't feel well. There's going to be days where your cats run around at 4 a.m. and you still have to come up and give a lecture, right? So, all we ask is, our job is to convince you that you can get through the program, and the culture we demand is that all we ask for is give us your best every day. It doesn't have to be your absolute best every day. Nobody can give their absolute best every day. Impossible. But we ask that you give us your absolute best, whatever it is that day. That's just how it works, okay? There's going to be days where you can't give your absolute best, but we want the best you have that day. Give it all you have. That's the only way you're going to get through it. We also talked that very first couple weeks about control, right? Control what you can control, okay? Tim Kite is a person that is sports affiliated, right? Has some football, lots of other programs, lots of education, lots of Board of Educations use his methods. And his method is, you don't control what happens to you, right? Things happen to you. The events happen to you, right? All we can control is our response to that event, right? So that's what we've also worked on so far this year. How do you control those events, right? His formula is E plus R equals O, right? You got it. Several years ago, 2 years ago in my daughter's class, we had someone that was in the Ohio State marching band. And I gave that talk, a very good orientation. He came up to me and goes, man, that was great. It was just like I heard at Ohio State like 7 times. You know, I guess that's good. I guess you've heard it before. But control what you can control, right? Control your response, okay? So we talked a lot about that. And I also shared with you a story that I'll share of my residency program director, okay, Dr. Jeff Bell at Riverside, ex-Marine, very tough guy, very demanding. He's a GYN oncologist, surgeon, could do everything, best surgeon I've ever seen. But if there's any military people in here, I apologize, I'm not a military person, but his motto in the operating room and in life and in residency was always the Marine motto, right? Improvise, adapt, overcome. Anything you have to do to get it done, it gets done. That's the way it is. And it goes back to giving your best that you have that day, all right? Whatever it takes. No, and we would get in the middle. I remember operating with him and getting in these giant OR disasters and all that. And he was the most calmest, coolest person I've ever seen. And you just do what you got to do to get it done. That's the way it is. And that's how it should be every day, right? You're going to come in someday. You're not going to have everything at your disposal that you wish you had, but you have to get through the day. And that's how it goes. Okay. So we talked a lot about that stuff in orientation. Now, during the rest of the semester, we've tried to teach you medicine, right? Medicine is very, very, we'll talk about how bad medical training is at the end, okay? But teaching medicine is hard. Learning medicine is hard. But we're also not trying to teach you just the facts, you know? part of the Marietta culture that we're working on is the art of medicine, right? Aristotle's quote is, you've seen this in class, educating the mind without educating the heart is no education at all. So we're teaching you more than just medicine, we're teaching you how to be providers. Right? I taught you yesterday a very dense lecture, probably the densest lecture of the whole year, right? And I told you that all those hours that we spent working on that lecture and I putting it together and all that, there's a good possibility that everything I taught you yesterday is going to be obsolete next year because they may change things, okay? So the facts are going to change, but how you treat patients and how you understand and do the art of medicine never changes. So hopefully part of our culture is we're teaching you more than just the facts of medicine. We're teaching you how to be the art of medicine and how to be providers also. People smarter than me, right? Albert Einstein. Education is not the learning of facts, but it's the learning of the minds to think. So whether you want to believe it or not, we're all trying to teach you how to think, not just memorize facts. Because medicine is more than just that. So we're moving on to rotations. Okay, there was only one golf ball in the lecture. I've added a couple, okay? You're at a very important time. You're at this transition time from when you're going to be in the classroom to where we are going to see you only every 5 or 10 weeks. Don't forget that we're here. Just because you're on rotations, we're still here, okay? We're always no more than a phone call or anything away. And I know a lot of you, as you sit here today, are worried about rotations. Okay? Oh my God, what's going to happen? I'm not ready. I can guarantee you, after listening to my daughter go in the exact same spot, and listening to her for 6 months say, I'm not ready, you're ready. You're never ever really ready for anything. We hear that all the time from the class, no matter what. But you are going to be ready. You're as ready as you're going to be. Okay? Another famous author, okay, Mark Twain. I've known many problems, but rarely do they come true. So you spend a lot of time worrying, not just you, everyone, about worrying about problems that don't ever necessarily happen. Okay? I saw a great quote in a book I read once. Practicing, that worry, they define worrying as practicing to fail in advance. Okay? The best way to flip that switch is to practice winning instead of failing. Practice succeeding. Visualize yourself succeeding as opposed to failing. Okay? Picture how winning looks rather than spending all your time worrying about what you're going to do if you lose. We'll go back to the golf theme. Golf is the theme of the day, right? You don't hit good golf shots when you are worried all you're going to do is hit a bad golf shot. You have to visualize. You know, you watch the Masters when we go home, like everybody, and a lot of pros will close their eyes before they hit their shot. They're visualizing their shot. They are not visualizing hitting it in the water. Okay? They are visualizing hitting a good shot. And that's how that works. So try and break the habit, no matter how hard it is, of always worrying about losing and think about winning. Picture how winning looks, okay? Because you have to start somewhere, okay? When you go on rotations, I talked to one of our preceptors who, by the way, is also a program graduate, and he goes, he loves having students for Family Med 1 and 2. Family Med 1 basically says the students know nothing, I have to walk them through it and all that stuff, it's great. They come back again 10 months later and do Family Med 2, it's fantastic. You know why? Because I don't have to do anything, because they do everything. And the students are so much better, and they see the growth in the students from Family Med 1 to Family Med 2. 10 months difference. And you guys are going to feel the same way, okay? you have to start somewhere. An expert doesn't start at the top of the mountain and become an expert. You have to start somewhere. And that's where your rotations are. And you've gone through a tremendous transformation from orientation to today. I can promise you that the transformation, is that me? That the transformation you are going to undergo from today in white coat to when we all get together again at graduation is going to be 20 times more. You are not ready to practice medicine when you leave the classroom in a few short months to go on rotations. There's why PA program is 27 months, it's not 12, okay? Your education is not complete. And you thought you learned a lot this year, wait till next year and how much you're going to learn. Okay, I do have a couple funny stories, one really funny story. A couple things about rotations. Everything that's been said already today is true about rotations, okay? Do as much as you can. Be prepared. You never know. Remember that motto, improvise, adapt, overcome, whatever it takes, okay? Be prepared. OB/GYN training is 48 months, basically of taking call every third night, so you're basically working 36 hours and off a couple days and doing that again for 48 months. I was on my ICU rotation as an intern. And I'm walking through labor and delivery at Riverside back to the ICU because the showers at our call rooms were better than the medicine showers. I had 5 minutes on my shower. And they said, we need somebody in this room right now. And I'm looking around. I've been there basically about 3 months. Like, I'm looking around. And they said, come on, let's go. The nurses knew I was one of the OB residents, right? It's like, okay. And this lady had basically just walked in and was delivering this baby in the bed, breech. And, you know, if you're the only one that's there, you're it, right? Tag, you're it. I'll share that with a lot of you guys next week, right, when we do our pregnancy lecture. Doesn't matter if you spend 20 years in derm, like Christina, okay? If you're on an airplane or somewhere and they find out you're a medical person and someone's having the baby, tag, you're it. You're doing the delivery, okay? So make sure that, and I read about it, knew how to do it. Never really did a breech delivery before, but thank God everything went fine. And then all the other residents come in and they're like mad. Oh my God, you got to do a breech delivery and all that. It's like, look, dude, I was just here, walking by. I'm not sure what you want me to do. I got basically pulled. I didn't want to do it either. I got pulled in the room and had to do it. Like, so yeah, I reprimand for that, but it is whatever. So. But as you go through the year, you know, you're going to get more and more comfortable with the medicine, and you're going to get better at the art of medicine. The art of medicine is something you're going to learn the rest of your life. We won't sugarcoat it. Medical training's terrible. It's hard, okay? But it's better if you enjoy the road, okay? Our esteemed lecturer looked back fondly at Marietta, how well she liked it here. Some of my advisees have heard this before, right? We do not want you to look back at Marietta on your time and think, oh my God, that was the most miserable 2 years of my life. It was terrible. Unfortunately, that's kind of how I look back at medical school, because it really was beyond awful. But part of it was my own fault, because I just didn't do it. It was it, right? It's better if you enjoy it as you're doing, okay? I am almost done. I did it with my dog and my wife and all that. It came out about an hour and 15 minutes. I go, I hope it's not that long tomorrow. But basically, for some of you who don't know, right, I was a math major in undergrad. How a math major ends up in medical school, that's a story for another day, right? But Pascal is a famous mathematician. I promise this is the last quote of the day. We're never really living, only hoping to live at the end. Looking forward to when we're always being happy. So we're never happy in the moment, we're always waiting for that moment to be happy. It's called the arrival fallacy in logic if you're going through there. Okay? If you're always waiting for that next thing to be happy, whenever that happens, then you always worry about something else to be happy. All right? So the point of this, since people are getting tired of me hearing, and the babies are telling me too. The bad news is, if you're always doing that, then you're never really truly happy. In medicine, this is the rest of your life. If you don't like learning medicine now and you're not happy now, the bad news is you're not going to be happy. Because you're going to be doing this the rest of your life. This is it. This is your chosen field. So my charge to you is enjoy the day. Be happy now. Okay? It's terrible. Embrace the terrible. Okay? But it also gets back to what I said earlier, right? The next block exam is in 2 weeks. Don't spend today sitting here worrying about the next block exam. Enjoy sitting here, enjoying your family and friends and getting your white coat and passing this big milestone. Because how you think about things, how you look at the day matters. In fact, it may be the most important thing. It may be all that matters. Okay, this is the conclusion. I'm almost done. Okay, never forget, learning medicine is going to be exhilarating. You have chosen the most exciting field in the world. You get to deal with people at their best and at their worst. So treat that as an honor, okay? It's going to be uncomfortable, you're going to struggle, but that's part of the growth, okay? We always talk about how there's no time in between adulthood and when we're waiting to be happy. Break that arrival fallacy. Okay? Worthy destinations are always protected by difficult journeys. It's always going to be worthy. So our goal is to help you along that journey. And my charge to you today is enjoy the journey because it's the best. You've chosen the best profession you can. Thanks. Okay. I have the golf ball, the magic golf ball. I pulled a student yesterday in class. I did not tell them out of the magic cup, right? Everybody hates the cup. That's how you get pulled on and have a lecture. The person I pulled was Deanne. Come on up. You're on. You can give it to whoever you'd like to give the lecture next year, and it cannot be me, or Dr. Cassell, or Dr. Howe. You have to do it right now, on the spot. Yes.
Thank you, Dr. Olton. Our last speaker is Miss Sydney Smith, the Marietta College Physician Assistant Student Society Class of 2022 President, who will share some words of wisdom from her upperclass men and women. Please join me in welcoming her to the podium.
Hello, everyone. For those of you who don't know me, my name is Sydney, and like she said, I am the president of the class of 2022. I'm beyond grateful that I was given the chance to represent my class for the past year, as well as today up on this stage. And I just want to start off by congratulating you guys, all of you. You're great. I want to take the time to thank you all personally for your hard work, dedication, early mornings, very late nights. I have many of those. And for pushing through the grueling moments that you felt like you would never overcome. And more importantly, I would like to thank the families, friends, significant others, and all support persons that have helped them along this journey into medicine, because it is truly something that someone cannot do alone. I would also like to give a sincere thank you to the faculty and staff of the Marietta College Physician Assistant Program, as they believe and fight for all of their students. And without their tremendous knowledge, service, leadership, and dedication, you as well as myself would not be experiencing this moment. So let's give the class of 2023, as well as all of the families here and the faculty, a big round of applause. So shortly after I was elected to be the president of the class of 2022, I realized that I would have to give a speech at this WICO ceremony, and truthfully, I panicked. However, these feelings quickly subsided because I'm sure we had numerous exams and assignments due that commanded my immediate attention. Honestly, I pushed the thought of this speech out of my head until a few months ago when Mr. Sams so kindly reminded me of my responsibilities with a warm and heartfelt email. I sat and stared at this email for quite some time, thinking about all that had changed from the day I was told I would have to prepare a speech to now almost 6 months down the road. I began pondering on the words and advice I was going to prepare for you all today, while also reflecting on 40+ weeks of clinical rotations. Unfortunately, a potent idea for this speech didn't immediately come to mind. It wasn't until about 2 weeks later, after unexpectedly receiving an encouraging message, that I was able to put pen to paper and begin the writing process. The message resonated with me so deeply at a time when I needed it most, which is why I knew I had to share it with you all today. The message was short and clear. Strength and growth come only through continuous effort and struggle. And I'm going to say that again. Strength and growth come only through continuous effort and struggle. The words were powerful, but they weren't meant for a PA student like myself, a medical student, doctor, or even anybody in medicine. They were meant for someone searching for a feeling of adequacy. The message emphasized the importance of always remembering where your strength comes from. And I call all of you to really think about this. Is your strength strictly self-driven? Is it a family member that motivates you, or even a spouse? Or do you have a religious background that calls you to work for something higher than yourself? Either way, it is imperative to always go back to where your strength comes from, because ultimately, this will push you to fight, to never give up, and to remember the valleys you trenched through to see the mountains. Some days you will feel like a gray cloud has formed over you. Some days you may question if you, just a small town girl, can change the lives of people around you. And some days your mind will linger to the thoughts of, will this ever get easier? However, each day you must find your deep strength and let it carry you through the halls of every different hospital, operating room, and through every encounter you have with a patient or provider, because you can trust it. Additionally, I advise all of you to find the strength to accept failure along the way, because failure is inevitable. Again, failure is inevitable. However, it is also what allows us to gain knowledge, insight into ourselves and others around us, perspective on life, and ultimately provides us with a gateway to success and confidence. Sometimes it's very, very hard to believe this, but trust me, you are going to fail at one thing or another. And you must take the opportunity to step back, reflect, pause, take a deep breath. But then, continue taking steps forward every day after that, without holding on to the fear of failing again. I'm not going to sugarcoat it and tell you that clinical year is any easier than didactic year, because it's simply not. I'm not going to tell you that you will feel productive every day, because you will not. I'm not going to tell you that you will be drawn to a specialty right away, because you will not. And I will most definitely not tell you that you will feel confident going into the operating room, performing procedures, or completing documentation for the first time, because you will not. But here's what I am going to tell you. You will be very anxious for your first day, and that is normal. And you will continue to be anxious for many days after that. But you are all very strong and dedicated people who have faced many challenges over the past year, all of which you have overcome. You are well equipped with the knowledge and expertise to provide care for patients, but expecting yourself to provide perfect care from the beginning is unrealistic. And while your knowledge base is immense, throughout your clinical experiences, you will grow that knowledge tenfold, just like Dr. Alton said. Therefore, expecting yourself to answer every question posed by a preceptor or patient correctly is again unrealistic. Your expectations for yourself should include failures, confusion, and the harsh realization that your performances are no longer measured by a percentage. Looking back, I without a doubt had very, very high expectations for myself, and anxious thoughts would run through my head like, what if I don't know the answer to X, Y, and Z? Or what if I move or even touch something incorrectly and a provider thinks I'm inadequate? These thoughts may run through your head as well, but there will come a day that you realize you are right where you're meant to be. Not only will you realize this, but you will realize that being a good provider does not equal being perfect. And for myself, truthfully, it took me many weeks to have this realization, and just to simply believe that I was living the life I've prayed about for many years. I can specifically remember a time when I failed miserably during my ER rotation, which is my third rotation. But on this specific day, we had a sweet young boy come in with a good old finger laceration, and my preceptor so kindly allowed me to handle him on my own. And keep in mind, this is my first time suturing, not on a pig's foot, but you all will have that experience. So my nervous self gathered all my materials, I numbed up the patient's finger, which that was a win for the day. And I had the patient soak his finger in some betadine. I then continued to open the suture kit. I put my sterile gloves on, placed everything where it was supposed to be, and cleaned the patient's finger. Again. At this time, my preceptor came over and was instructing me, ensuring that I was going through the steps correctly. I nervously got my suture out and loaded it into the driver, but somehow completely forgot how to load the suture into the driver. I was just standing there, very shaky, maybe wanted to throw up, I don't know, it was all black. So, I completely forgot that, and in that millisecond of panic, I unconsciously removed my stethoscope from my neck, put it on the table like any normal day. Therefore, I broke sterile field, and as a result, I had to start all over again. Now, this is just one small example of a time that I have failed. And I could give you many more examples, but the most important thing to take from this is that I have never once broken sterile field again. I have never once loaded a needle driver incorrectly since then. And I've learned that in the moment, it's okay to require instruction by someone who has a lot more knowledge, expertise, and experience than you. So, I leave you with these two things. Accept failure, as this truly allows you to flourish. And cherish the driving force behind your strength. Always keep it by your side, in the back of your mind, and allow it to guide you through this beautiful season of life, because it is enough. I cannot thank you all for being here on this special day, celebrating the class of 2023, and I know that every single one of them also expresses this gratitude as well. I wish you guys all the best of luck as you finish out the year, but most importantly, I wish all of you a clinical year full of knowledge, growth, self-discovery, reflection, and true happiness. Thank you all so much, and congratulations.
me. Students, as I mentioned before, you have now transitioned from a student to a healthcare provider. With receiving your white coat, you also receive its historical symbols of healing, hope, and professionalism. This obligates you to acquire all the expectations, responsibilities, and commitments that live in its pockets. Although you still have much to learn about medicine and patient care, and your short coat will announce this to others, soon you'll be working with real patients. Patients who, when they see you in your white coat, will see you as a healthcare provider. They will trust you with personal information and expect you to be competent, professional, and compassionate. They will expect that you remain current with the science and technological aspects of medicine without forgetting the importance of compassion, empathy, patience, and the power of the human touch. I want to thank you all for coming today to be a part of an important ceremony for the class of 2023. Class of 2023, please stand. Congratulations on your white coat milestone. Welcome to the PA profession. So the members of the class of 2023 will proceed to the McDonough steps for a group photo. There are also going to be light refreshments and cookies for everybody else, and then you guys can come back in and take photos with family. Thank you so much.